movements of the mandible. Here we didn't write movements of the temporomandibular joint. Why? Because if we take temporomandibular joint, superiorly articular eminence will come and inferiorly condyle of the mandible will come. So here the articular eminence, superior portion of the superior articular facet, it is a stable, and here only mandible will move in the temporal joint. So that's why mandibular movements are motion. So here the movements are, first one mandibular elevation, second one mandibular depression. The elevation movement also called as the mouth closing, and the depression, mandibular depression, is nothing but the mouth opening movement, and two more movements will be there. Those two movements are mandibular protrusion, and second one, fourth one, mandibular retrusion, and last one, fifth one, the movement, it is a little special movement, that is the mandibular lateral deviation. So these are the movements of the mandible. If we see protrusion means, suppose this is our mandible, here we are having teeth, okay, this is our maxilla, here we will be having teeth, this is upper, this is lower. Protrusion means the mandible will move forward, that is protrusion. Retrusion means mandible will move backward, that is retrusion movement. Lateral deviation means, suppose if we take mandible, if we are seeing mandible laterally, this is the medial pole, lateral pole of the mandible. So this is our chin, so here we will be having teeth, So imagine we are seeing the mandible superiorly. So in this point here, lateral deviation means it may rotate to left side, it may rotate to right side, that means side by side. So these are the lateral deviation movements of the mandible. Now we will see one by one. Now we will see these two movements, mouth opening and closing. These two, mouth opening and closing, will be happening because of the two arthrokinematics. Those are, first one rotation, and second one translation. These are the arthrokinematics will happen in the mouth opening and closing. Suppose if we take mouth opening, first one will happen rotation, so that if the patient is opening the mouth, what will happen? Pure anterior rotation of the condyle, will happen with the help of the articular disc. So that here the point is, the rotation is going to happen in the lower joint. After that, translation should happen. No. So the second phase involves translation of the disc condyle complex anteriorly, at the same time inferiorly along the articular eminence. This motion occurs in the upper joint. This motion occurs in the upper joint between the disc and articular eminence. So that here point is very clear. The rotation is going to happen in the lower joint. Translation is going to happen in the upper joint. That's the point here. So here if we see the normal range of the mouth opening, it is almost like 40 to 50 millimeter. 40 to 50 millimeter is the normal individual mouth opening range. Now if we see mouth closing, it is nothing but the mandibular elevation. Mouth closing is nothing but mandibular elevation, and the arthrokinematics, what happened here, it will become reverse. Means first one rotation, here it happened anti-rotation. If mouth is doing elevation like mouth closing, here first one pure posterior rotation will happen in the lower joint, and at the same time here upper joint, first one rotation, okay, posterior rotation will happen. Second one translation, when we are doing mouth opening, which translation happened there? Anterior inferior translation happened in the upper joint. When we are doing mouth closing, which translation will happen? Posterior and superior. So here in this upper joint, posterior superior translation will happen. These are the arthrokinematics, okay, translation will happen in the upper joint. So this is about the mouth opening and closing, also called as the mandible elevation and mandible depression. Clear? So now this is about the mandibular protrusion and retrusion. Protrusion movement is nothing but the mandible will move anteriorly. So here when we see this protrusion movement, there is protrusion and retrusion. Here only translatory movement will happen, and there is no rotation. Rotation will happen in the joint, okay, when we are doing protrusion retrusion. Purely these two are the translatory movements. There is no rotation involved in the joint, and that too here mandible when it is moving anteriorly. So the movement, how it will happen? Anterior and inferior. Anterior, see, anterior and inferior translation will happen in the upper joint. There is no involvement of the lower joint in the protrusion retrusion movement. There is no involvement of the lower joint in the protrusion retrusion. Here only upper joint will involve with the help of the disc, with the help of the articular disc and articular eminence of the temporal bone. So the upper joint is going to move anterior and inferior. It is going to create the translator movement, so that protrusion movement will happen. So the normal range of the protrusion, it will be 6 to 9 millimeter, 6 to 9 millimeter. Now if we see retrusion, it is exactly opposite. Here again same translatory movement will happen, and here it is going to move opposite. Here anterior inferior translation, here posterior superior translation will happen, at the upper joint only, and the normal range will be 3 millimeter normal range of the retrusion. So this is about the mandibular protrusion retrusion. Now we will see the last movement of the mandible lateral deviation. Suppose this is the mandible, we are saying superiorly. These two are the medial poles of the mandible. These are the lateral poles of the mandible. Okay, so now we will see lateral deviation. Suppose the mandible, this is the chin. How the mandible can move? This is right side, this is left side. So if we divide it into two parts, right and left parts, the mandible can do side movement to the right side and side movement to the left side. Suppose we are taking example right side. Okay, right side, suppose mandible is moving. If the mandible is moving to right side, the side where it is moving, the side where it is going, that side, the condyle, the mandibular condyle will spin like rolling movement will happen, It is going to spin, no, here I wrote reverse. Okay, so it is going to spin on the right side and opposite side, here forward gliding will happen in the gliding, or translation will happen in the opposite side, so that the chin can move to the lateral side, right side. So here the point is, when the mandible is moving to right side, the side where it is moving, that side mandible condyle will spin to the same side, and opposite side where, if we are moving right side, left side, the condyle, it has to move forward, so that spinning movement, see the spinning movement on the right side and translator movement on the left side. If we do like this, then only the mandible can shift to the right side. So what is the normal range of this lateral side by side movement of the mandible? Here is almost 8 millimeter. It is the normal range of the lateral deviation. So this is about the movements of the mandible. Clear?